Hi, my name is Yanina Santander. I am PhD in pharmacology. I am from Argentina. Now I am doing my postdoctoral position in University of Mexico. And today I'm going to talk about my project called Effect of Corticosterone on Blood Pressure in SHR ovariectomized rats. So, like introduction, hypertension is a major risk factor for cardiovascular disease, and everybody knows that spontaneously hypertensive rats is a model that mimics genetic hypertension, like in human disease. And I work with female SHR that generally exhibit lower blood pressure. Uh, um, this is because female has the estrogen that has a protective effect on cardiovascular disease. And because of that, I do have ovariectomy. That means that I extract the ovaries from these rats, and this reduces estrogens and leads to increased blood pressure. On another hand, corticosteroids are known to potential the effect of angiotensin II and upgrade the AT1 receptors that they influencing in the blood pressure regulation. My objective is evaluate the effect of corticosterone on blood pressure in these types of rats, in SHR ovariectomized rats. For this, I use 6-month-old SHR and Wistar Kyoto rats, both male and female. Females were divided in two groups, ovariectomized and not ovariectomized. And we use also an additional group of 12 months old female SHR because this age in rats is known that they have a stop in the estrous cycle. It's like menopause. Yeah. So we measure the blood pressure using a takeoff plethysmography, and also we measure the body weight and the systolic blood pressure after administration of corticosterone. First of all, body weight was increased in both groups, ovariectomized Wistar Kyoto rats, known like normotensive rats, and SHR ovariectomy. On the other hand, blood pressure, especially systolic blood pressure, was increased in the group of SHR ovariectomy, but not in the other group, in Wistar Kyoto ovariectomized. And finally, when we administer corticosterone to all groups, we didn't notice any change in the blood pressure. So in conclusion, ovariectomy elevates systolic blood pressure in SHR, while corticosterone administration had no effect on blood pressure in any of these groups. Thank you very much.